Welcome to the HealthspanMD podcast. So welcome to the HealthspanMD podcast, where we talk about the science of longevity. And today we are going to talk about one of the strongest predictors of longevity, the one thing that you have control over that is arguably the most powerful indicator of how long and how well you are going to live. Now, just as a review, we talk about this all the time on the podcast. The essentials of longevity are a strong body, a healthy brain, and avoiding preventable disease and premature death. Well, today we are going to focus on the strong body part. And to help us navigate this crucial aspect of longevity, we have a real expert with us today. Chestiny Fair, exercise physiologist, professor of exercise science, who is joining our HealthspanMD team to help our patients have the strong body necessary for a long and vital life. Welcome, Chestiny.
Oh, thank you for having me.
It's such an honor to have you. I mean, we met about a year ago, a little over a year ago, right? And at that time, I was just starting my practice, trying to figure out how it all fit. But I remember even now, you were with a friend of yours, and you're just like, I love what you're doing here. Like, this is the things that I'm doing as well, just from an exercise physiology standpoint. We knew we had a lot in common, but it took us a little while to figure out exactly how to mesh those. But, I really want to dig deep into your expertise here. And I'm going to start with, can you give me some an explanation to the audience about why fitness is such a critical component of longevity and overall health?
So when we think about longevity, we think about the duration of life that we have. Aging becomes a part of that conversation. And we all would hope to want to age gracefully, as we go into our later stages of life. So when it comes to longevity and fitness is going to be efficient for us to maintain healthy bodies, while we can actually build more lean muscle mass, improve our cardiovascular fitness and health. We also want to incorporate fitness to decrease their chances of chronic diseases, heart disease, diabetes, and cancer for sure. It can also be very beneficial for like depression and anxiety. So when we think about longevity, we kind of think about all of those components of life and how we age and going through our different stages of life. So having those different areas, as we work on those different areas, I should say, can help us to live longer potentially, and also can reduce some of those potential like health history things that we might be more privy to based on our just family history.
Yeah, so, that makes tons of sense to me. Like, fitness ties so many things together. The more fit you are, the more likely you're making other good choices for your health. It's a chicken or egg thing. Like, if you're healthier, then you can be more fit. If you're more fit, then you can be healthier. But I think fitness boils it down to a simple number that we can, understand, measure. And as you know, as an expert in helping people achieve a healthy life, having a clear path, like, okay, here's where we're headed, in measurable, goals along the way, that's really powerful. And, I think fitness has been one of those things that we intuitively understand that we want to be fit, whether that's strong, whether that's cardiovascular fitness, whatever that is. And we also recognize that as we gather birthdays, that gets more challenging with time. But, what was really striking to me, and I guess what brought fitness to the forefront of my mind in my practice, because my practice has always been a longevity practice, although it started as a preventing heart disease practice, and then I realized a lot of things that prevent heart disease prevent like dementia and cancer and stroke, and eventually it all kind of culminated in all of these things actually live to longevity, and not just length of life, but quality of life as well. But I came across a research paper where this was a big study, like 120,000 people followed for 14 years. Like in medical science, as you know, that's a good quality study. And they looked at predictors of longevity, and the usual suspects were on the list. Like having heart disease was a predictor of mortality, earlier death, smoking, obesity, all of these things were on there. But when you looked at the magnitude of their ability to predict mortality, and so, for example, I remember a couple of these off the top of my head. Having heart disease increased your likelihood of mortality about 29% over not having heart disease. Smoking about 40%. But when they added fitness as measured by VO2 max, that was far and away the most powerful predictor of mortality. And in fact, taking somebody with low fitness versus exceptional fitness, it was a 500% difference in predicting mortality for that one single measure. And I'm like, okay, I have to incorporate this into my, in my practice and helping my patients understand their opportunities to live a long, healthy life. So can you tell us a little bit more about VO2 max? Why is it the measure that most of the experts seem is the best measure of cardiovascular fitness?
So the VO2 max assessment is a test that actually looks at your cardiorespiratory fitness. So we're looking at the functions of the heart, the respiratory system, and we're also looking at how much blood the heart can actually pump. And by doing that, we can see the maximum amount of blood that's being pumped through the heart is going to be very effective for overall health moving forward as far as longevity and your cardiovascular fitness overall. So utilizing this test is something that I don't think a lot of people actually know about. I mean, I think it's heard of, but usually we look at it as more like as a scientific test, but not in more of a general environment, like, a doctor's office, maybe, other than if you're seeing a doctor for a heart condition, you might take a test. But people aren't necessarily putting together the correlation between individuals that aren't necessarily athletes being able to utilize these tests and how it can improve your overall fitness. By understanding that data, what we can do is also formulate some sort of program that can also be beneficial to help them be more effective with being consistent in improving their longevity. So I think we need to probably educate people more on what the VO2 assessment can actually do. And I think by doing that, we might see a growth in the amount of people who are actually wanting to do it that aren't just athletic, that like athlete specific, like are doing it for sports performance reasons, and maybe those individuals who just want to do it as a way to improve, their health overall.
Yeah, I guess I just making the point in this is that medicine traditionally has been a diagnose disease focused process, right? Reactive. We're looking for disease. And I think that's where VO2 has been underutilized as a real marker of health, just like blood pressure, just like cholesterol, more effective than we put so much weight on a BMI. Like there's not a medical chart in the world that doesn't have the BMI calculated on it. That's that's a blunt tool at best, right? My experiences with VO2 as a cardiologist were we really did this in two situations. One was, do you need a heart transplant? We were looking at really sick people and using that VO2 as an objective measure to say, okay, this is somebody who looks really sick and they are really sick. And then we also used it some in helping us figure out people who were short of breath and what was the limitation. Like, was it a lung issue? Was it a heart issue? But outside of that, the only time I really had exposure to VO2 were in high-end athletes. And yet, as you say now, this is a tool that has a lot broader, role than what we have used it in the past. Tell me a little bit about where you've used VO2 as an exercise physiologist in the non-athletic population.
So some of the VO2 assessments that I've done, we actually opened up VO2 max assessments at the university where I work to the general population for individuals who are looking to just know their VO2 for whatever purposes. And one of the VO2 max I've done was last year, was on an older lady. She was like 76, and she was an endurance athlete. She ran long distances, but she had also had some previous injuries that she had been working through. So she came in to do her VO2 max assessment just to kind of see where she was. She wanted to get her VO2 max data so that we can actually maybe see where we could improve for her endurance performance. The thing is, she's doing this for fun, but this is something that she does on the regular, but she's also doesn't consider herself like an athlete. She just considers herself someone who does this for exercising, and she just loves to run. Her VO2 max for a 76-year-old woman was actually high. It was higher than what we see for a person 60 plus. We typically see it a little bit lower. So for her age, we actually saw her VO2 max was a lot higher, which was great, because it showed that her body was utilizing oxygen very well for her muscles and her heart was pumping regularly. The only problem was, and I know this is something that I'm going to talk about, is her balance. She has some issues with her balance. So when you're doing a VO2 max assessment, we take all of those things into consideration. Is there an issue with your balance? Are you trying to hold on to the treadmill while you're doing it, while you're running and performing this assessment? Those things can contribute to the test results. So, ultimately, I don't want her holding on to the treadmill. So we had to take that under advisement. So, while her VO2 max reading came out pretty high, I still had to think, okay, maybe this data may not be necessarily as accurate as I would like it to be, because there were moments where she was kind of having some issues and I had to adjust the test accordingly.
Yeah. So, as I think about this, you could actually give somebody an aerobic fitness age, if you have a 50th percentile for 60-year-old, for example, and somebody who's 40 only performs at that level, they'd have an aerobic fitness level or age of 60. And so, and I understand, I kind of like that concept, because it takes complex topics and boils it down to a simple number for understanding. Of course, there's also limitations to boiling it down to a single number, but I think it could help people get the gist of that potentially.
Yeah, because when it comes to science in general, when you start talking about things like cardiac output, oxygen utilization, those are big terms that we throw out in certain company. I only say that because only certain people might actually understand at that point. But I think if you break it down to something that, most people understand performance wise, and you break it down to things like age, and you break it down to things like, how can I get better? You get better by doing this type of exercise for this period of time, and then we can see improvement in your VO2. I think that makes it more understandable for like the general population. But I also don't want to make people who may not be as sciencey feel like you're ignorant, right? You're not ignorant. You're just, maybe the terminology may not be something that you readily say or know, or it might not be in your repertoire. But I think we can still explain it well enough so that people can understand that there's a benefit that they will receive by performing a VO2 max, and we can explain it to them in a way that they can understand it, make them feel powerful. That
makes so much sense. And it's part of I'd always talk to the trainees, the physician trainees about this, is that you come in as a layperson into medicine, you have to learn doctor speak, right? But then the next step is you need to be able to translate doctor speak into real lay people speak again. And so it is a learning curve along those lines. Well, one of the things I want to talk about is, and maybe a real stimulus for us actually starting to work together was, attaining a VO2 in the past was pretty complex. Like there was, tubes and wires and all these things all over the place. And you really needed a lot of expertise to perform the test accurately. But also it was uncomfortable. Like I did one myself, and I'm like, man, I don't, it was an awkward thing. And I had a lot of other patients that I'm never doing that again. Like that was really tough. But, now there's this device, VO2 Master, that, I first heard of on podcasts with experts that I trust. And they're like, wow, this is so much simpler and it is really accurate. And so I reached out to you and I said, hey, well, what do you think of this device? And you're like, oh yeah, we've been doing this for a while.
Yeah.
Tell us a little bit about, I guess, frame it in a way of somebody's coming into our practice or into your lab, and you're going to do a VO2. How does this VO2 Master thing, what should they expect, and how does this make it easier on them to get the data that you need to guide them?
Okay, so there's two different ways that the data is collected similar between the two types of data collection. So what I mean by that is, like, for the traditional scientific way that we would run a VO2 would be with the metabolic cart. That would be your treadmill or your stationary bike that your patient or client would be on as your tool. And then you would have a metabolic cart. That metabolic cart would have the tubings that you're talking about, the face mask that the person would put on, and all of the tubes be connected to that person. The tubings and the face mask allow for no external air getting through the mask. We want to be able to analyze the client/patient's oxygen. So CO2 is calculated and oxygen is calculated. So we don't want anything coming in. So the person must breathe through their mouth. So that is a claustrophobic disaster for a lot of people, especially when you're talking about adding in intense, maximal intense cardiovascular fitness or activity. Right. So that metabolic cart is calculating all of that. It has to be calculated for the air density outside in the room. And then we have the computer, which calculates the data. And so that becomes the scientific experience of that is a lot more sciencey. Right. So it's not an environment where people think that it's more like a laid back environment. I feel like the VO2 Master Mask is a little bit more laid back. Like, you can take it anywhere. It's portable. The metabolic cart's not portable, right? So when it comes to the testing itself, the devices, positive or negative, one is portable, one isn't, right? If we want to talk about the differences in the device. However, they both will require the same strategies as far as getting started. So, like, we would want to make sure the person signs consent form. We have any health history information on the person. We want to make sure there's no medical conditions that are keeping them from having to participate. That would be, heart conditions, right? So we'll make sure that they're clear for physical activity. And then we go into setting it up, the mask, and getting them set up. That all is different. Like I said, between the two devices, that's different. So the Master Mask, you put the device together. It has similar components, but it's more self-contained. So you put it together, put it on your face, making sure the person is breathing through their mouths and not their nose, so that we are getting the data. The data itself is reading the data is easier for, obviously, someone who knows what they're looking at. But when you're explaining it to the client, you just want to make sure that you're pinpointing certain things. Your heart rate will be tracked during this. So we're going to take a heart rate. We're tracking heart rate. Where the person's going to wear some form of heart rate monitor. So that's being tracked consistently throughout the test. The test is also run by utilizing certain protocols. So we might use the Bruce or FACC protocol for those assessments. It is going to be a test where the intensity and incline will be adjusted accordingly through different stages. So as we're going through those different stages, we are talking the person through that, because we want to make sure that they can actually participate. But let me digress and say, prior to actually starting the test, we do a warm-up, right? So the warm-up is meant for the person to be able to still communicate if they need be, but not verbally. We just want head nods. We're going to look at a RPE, rate of perceived exertion, to see how they're feeling. All of those things are going on simultaneously. So it's a lot happening at once. And what we're looking at the heart rate. We're looking to see where the RER is. We're looking at the VO2. There's a lot going on. So I think those two different devices are similar. They provide certain certain abilities for us to be a little bit more flexible and lean in with the procedures that we do, and that VO2 Master Mass doesn't just lend itself to the treadmill or the bike. It lends itself to a whole host. It opens us up to so many other ways to calculate VO2, box jumps, medicine ball toss, all of it.
Yeah, that is a very attractive thing, and really opens it up to using this as a tool that can be more broadly applied to a broader, to more individuals, and especially in longevity. What has your experience been? I know in healthcare, a lot of times the testing can be really paradigm shifting for people. I give two examples. One, somebody comes in with a family history of heart disease. They're healthy, like everything looks good. But we do some assessment of artery disease, whether that's a carotid ultrasound or a CT calcium score, and we show them, hey, you're making artery disease. That at first it's a shock to them, like, oh my gosh, I had no idea. I thought I was really healthy. But then oftentimes they'll flip to, okay, this is an opportunity. Like, by knowing this, I know what actions I need to take. I know where I need to go. DEXA for body composition, that has been eye-opening for most people. Like, okay, some people come in and say, okay, I knew I was going to have too much fat or whatever it was. But a lot of times people come in and they'll look at the results and say, ooh, I thought I was in better shape than that. Right. I didn't think I was that I had that much visceral fat, or I didn't think my muscle mass was that low. Have you had the same experience with VO2? Like, is that sometimes an eye-opening thing for people to say, well, I need to quit fooling myself here. Like, I'm not as in good a shape as I thought.
Yeah, I've had a couple of clients who said that during their test. I will say, out of the general population that I've worked with, I think more of them were more so like, okay, they accepted the fact that they weren't sure where they were going to be. And I think because they came in with no preconceived notions of like their fitness level, other than, okay, I work out a little bit. I think where I see the most shock and awe is with the athletes, right? Because their performance level and what they do on a regular basis is train for performance anyway. So every summer, their VO2 max assessments are completed. And with that being said, they're looking to have improvement, and when they don't have improvement from summer to last season, they start to feel like, what didn't I do? What did I do wrong with my training? So a lot of those questions come up. Outside of them, we've had a few coaches come in and do their VO2 max, which I thought was really interesting and also quite funny, because they're ex-athletes. They've exercised a long time. They've actually have been in the industry for quite some time now. They're coaching and training, and their expectation when they come in is like, oh, I'm fit. I know I'm good. I there's nothing going wrong with me. My activity level is great. I exercise every day. And then you get them on that treadmill and you start increasing that incline and increasing that speed, and then their calves start burning because they're not getting enough oxygen to those muscles. And then it's like every excuse in the book I don't train like this on a regular.
Isn't that true? But I think that's human nature. I mean, I have blind spots. And my patients have blind spots. Like, I think that's one of the roles of coaching, is that having that external, somebody who cares about you, somebody who's expert, but can point out your blind spots.
Right. Yeah.
And the VO2 just seems like that in spades. Like, I'm excited to have this in my practice, because I think it just adds that extra opportunity for me to help people understand where their opportunities are. That's it. And I tell them all the time, like, I know traditional medicine is, we're going to do this test and we're going to look for a disease. This isn't that. That's not our intention here. We're going to look for opportunities. That's why we're doing the VO2.
Yeah. So I've had 3 VO2 max assessments done on myself. And once earlier on, the VO2 max assessment was just, first of all, I've done a bunch of them in college. When I was in college, because, to learn how to do it, you have to do the VO2 max assessments with your classmates, right? And for some reason, I was really good at calculating heart rate manually and blood pressure while the person was in active mode on the treadmill. But I actually did them personally when I ran a few marathons. And I wanted to know where I was because it was important to me for my training. And being the actual client in that respect, it gives you a whole lot of respect for those individuals who are going through the VO2 max assessment, because you understand what they're going through. And I think it puts me in a mind frame to like help them want to succeed. I know that I have to somewhat put you through this stressful situation with this VO2 max assessment, and it's not probably how you normally train, but the outcome and the data and what it's going to do for us once you're done, how it's going to help us help you, is where we want to get to.
Yeah, no, that makes perfect sense. Well, along those lines, now we have all the, not enough data is not our problem anymore. Right. Too overwhelming amount of data is our problem. And now all these devices give you your estimated, we'll put quotes around that, VO2. What's been your experience in people sharing with you their Apple Watch determined VO2 or whatever device they're using versus the actual measured VO2? Are they usually the same? Are they often off? What's been your experience?
From what I've seen, they've been a little bit off, only because we're talking about age predicted heart rate max. And then we're looking at like 80% of age predicted heart rate max. So if we're looking at age predicted heart rate max, it is an estimation of your VO2. It's not going to be an exact VO2 because we're not getting that other data. We're not collecting the oxygen, CO2, seeing what your heart is doing in relations to your body's ability to perform under stress. So it's not going to be as close as what but overall, the estimation of the VO2 max can still be utilized for helping to improve performance.
See trends, and that kind of thing.
Exactly, because we do similarly when we look at things like submax assessment. So like if we're looking at a submax, like a Queen College step test or a YMCA step test or something like that, we do age predicted heart rate max. So we're still calculating VO2 using the equation. We use the Mifflin-St. John equation for that, but we're not getting that direct correlation from what your body's actually producing. So, I mean, like you said, it's good to have it, but the VO2 max assessment would be better.
Yeah, that's, and the analogy of this is what I've realized from our DEXA scan on body fat percentage. I have a scale I get on every day that gives me a body fat percentage. And, it's in the ballpark. It's not like crazy off, but what I struggle with is that it's so variable from day to day. Like I've lost 4 pounds of muscle in one day, according to my impedance device scale, whereas the DEXA is actually looking at the measure. And so I think that's what makes sense to me. And what I tell people is, look, use that to track trends and things. But if we really want to know, if we want the most accurate measure, then we need that's not going to be the source of that. Would you agree with that?
Yeah, I totally would agree. I mean, I've participated in a lot of bod pod assessments. So similar to the DEXA, we get some similar data. We don't get the bone density portion of it, but we get the intercellular, extracellular water, fat, body fat, muscle mass, and things like that. And again, if the conditions are good, meaning that the person actually followed the correct conditions prior to doing the test, then we can get some really good data from it.
Right.
But, if we're getting people coming in, that's why it's hard to also to take the data from maybe places where they do VO2 max assessments, do it in the if the time of day, what the person has done, like have they eaten, what's their their body water content, all of those things play a part in potentially the outcome of the data. Yeah. So like you're saying, great for having the data to utilize it for improvement, but as long as the conditions are correct and the test is followed to the procedures, we should get really, really good close data.
Yeah. Yeah. So somebody comes in and they have a VO2 that is not where they're hoping it to be, like whatever measure we're using or whatever their expectations are. How changeable is that? Like, I'm sure there's a genetic component to this. It just seems like there's some people that have a level of fitness without even trying that hard. Then there's people that really struggle with getting the fitness. But in your experience with the proper approach, whatever that is, zone 2, HIT, combination, how changeable is a VO2 and how long does it take? What's the time course of that?
So, is it changeable? Of course. With consistency of a program, and we're looking at minimal working out 2 to 3 days per week. That's the minimal amount of activity. And being in zone 2, working moderate intensity, and that's starting out. So like, even if we're talking about someone who isn't very highly fit or highly trained, someone who may or may not have been somewhat sedentary, we want to improve their VO2 over the course of like 2 or 3 months. We could probably have them do a training routine, maybe some HIIT training, something that improves their cardiorespiratory fitness, also some strength training that can improve muscle mass. We want to see these changes. 30 days out, we could probably reassess. But realistically, if we're talking about maybe a person who isn't as active to a sedentary person, we probably want to see at least a good 60 to 90 days to give them a really good opportunity to kind of get some of that training under their belt. And in the middle of those months, we can still do some body comp assessments. That will actually help us too to determine, hey, maybe we can do a VO2 max a little bit sooner. If we're starting to see, lean muscle mass improve, if we're starting to see body fat decrease, if we're starting to see changes in the body overall, we're starting to see improvement in cardiovascular fitness, if we're getting progression, if we're able to progress the workout routine and they're able to increase intensity, and we're seeing that in real time through the program, we can probably reassess as soon as 60 days. But again, yeah, maybe genetics might play a little bit part in that. But also, I think the consistency of the person. Like, are they staying on track? But let's not forget, one of the biggest parts of this conversation is going to be nutrition. Like, because we can exercise all day. But if we're not eating healthy as well, then, we're not going to get the best out of ourselves.
Amen. So, that's our practice. And, we talk a lot about the right habits, and the right habits are unique to each individual. Right. But the framework is without question. It's nutrition, it's physical activity, it's sleep, it's stress, avoiding toxins, whether that's excess alcohol or smoking, or, even certain people can be a toxin as well. Connection, all of those, having those habits and aligning those unique to each individual. There's no one size fits all, but they also build synergistically on each other as well. And even when you get to fitness, like, I love that you've already addressed the, talking about strength training and muscle mass in this. This was a conversation I had 20 years ago. I was at Mayo Clinic, and one of the world's greatest Ironman athletes, like, somebody, I don't follow that world, but the people who did, when I'd say, oh, I met this guy, they'd all say, oh my gosh, you met him? Wow. Mm-hmm. But I remember having a conversation with him because he was looking to do a collaborative thing with Mayo Clinic, and he had told me he had already won Ironman, a couple of times, but he said, I realized I had to go strength, add more strength training if I was really going to take it to the next level. And then he added that in, and it wasn't natural to him. He really had to work at it to get it in. But then that allowed, and that just propelled him to, the GOAT status. Like, he was a really high performer. So, that part is aspect of this. And I want to talk, though, about something that is not thought about as much in fitness, but you alluded to this earlier, and that's this concept of stability, balance, core strength. We think about fitness, and I know I have defaulted to that in the past, that fitness is either aerobic, how long can I run, or whatever, bike, and then fitness is your strength and muscle mass and things. But you point out that stability really important in this as well. Tell me a little bit more about that. Like, maybe how do you assess that? And is that changeable? Is that something that also people can have, some impact on?
Yeah, so we look at balance, flexibility, and stability when we talk about programming. We look at all those components because, as I mentioned at the start, as we age, we lose some of our mobility, our motor skills. So those motor skills will decrease. So I always like to bring up the example in my classroom of how many senior citizens do we see tightrope walking when they're outside, like walking on the curb? Like, do we see children doing it? Yeah, because they're constantly developing their motor skills. But we don't see a lot of us as we age doing those things. Or like, how many kids do we see jumping off of random things, in the home or outside? They're constantly working on those smaller stabilizer muscles that improves balance and stability. But as we age, we kind of get out of that. So we lose the ability to call on those smaller stabilizer muscles. And so as we get older, we have to be more conscientious about actually working those. So different programs can include stability training. We look at this as also because as seniors age, as we age, fall risk increases. And then there's a lot of risk of falls due to like regular household stuff, like things you don't think about, like an oriental rug, and then you fall down and now you're hurt and now you have a injury to the hip or to the knee or to the ankle, to the arm, to the shoulder. And when we talk about injury, so flexibility, balance, and stability, we want to work on that because it can help improve those joint function of the joint. And by improving the function of the joints, it can help them even more so with their strength training and their cardiovascular fitness and just normal life, activities.
Yeah, I realized that with my practices that I need, we have dietitian, nutrition experts, we have, personal trainers, we have, exercise physiologists. We have all these aspects. We have a very close connection with physical therapy as well, because that is, one of the biggest threats to us as we, get more birthdays is a fall. Like that is the demise. You talk to a doctor and say, oh, you know what? My 80-year-old mother just fell and broke her hip. And that doctor will probably visibly wince, and say, ugh. Almost like, oh, my mom has metastatic pancreatic cancer, because the mortality of that is almost as high. I mean, it's like 30% in the first year, a broken hip. And it makes sense now when this is one of the really striking studies that I came across, and we've talked about it on the podcast before. They did DEXAs on people that were going in for hip or knee surgery, and they did them on the day before the surgery. And then 4 days later, when they were discharged from the hospital, and in 4 days, the average muscle loss was 3 pounds of muscle. Like you're 70s, 80s, and losing 3 pounds of muscle in 4 days. Like you can just, like, it all kind of makes sense like that. And of course, who's going to fall? Somebody who's more frail and all those things. But man, when you talk about preventable causes of death, that's got to be at the top of the list. And so that what you're saying is that's something that is trainable, though. Just like improving your VO2, we know you can improve your VO2. We know you can add muscle mass. I'm going to tell a quick story because I love this so much. So about 3 months ago, I saw a patient. He's 93 years old. Doesn't exercise, but he feels pretty good. And he's like, you know what? I just want to hang on as long as I can. Like his best quality of life. I saw HealthspanMD. I'm going to come in and just see what you got. And so he starts working with our coaches, and they're talking to him about getting protein in his diet because he wasn't eating enough. He starts walking only. 6 weeks into it, he's like feeling good. He starts adding a little weight training, but he decides he's going to get a DEXA every 3 months because he says, look, at 93, I can't wait around, right? You know, yes. I need to figure this out right away. So he gets a DEXA 3 months later, and he lost 1.2% of his body fat and gained 2 pounds of muscle.
Wow.
In 3 months at 93. And it was so inspiring to me to say, okay, not too late, right? Yeah. I'm 58. I can't, but also called out my limitations. Like I can't make excuses. This guy's putting muscle on at 93. I can't say, oh, I'm 58. I can't do that. So, but you're saying that the stability, the flexibility, these are things that people can actively work on and improve. Is that?
Yeah. And we like to offer up things like yoga, Pilates. These are things that we would add into a program to help a person improve on like the pelvic floor, help them improve on strengthening the abdominal muscles, which in turn can help, with hip and mobility and things like that. We want to add those things in because, like you mentioned, muscle wasting is a thing, and it can happen if you aren't performing or you're not doing any physical activity. But, aside from that, we don't want to get too technical, but testosterone is something that we kind of also consider as well. Yep. When we think about the potential for muscle development. And especially as we age, the hormones become a big contributor into how our bodies develop or how we can maintain healthy bodies moving forward into our older years. But those things, flexibility, mobility, added into training. Working out on unstable surfaces aren't just for individuals who perform different types of sports on unstable surfaces, right? So we want to do that too. Single leg activities, these are all kinds of things that we can do to help people, especially when it comes to, like I mentioned before, just your daily lifestyle activities, like reaching on the counter, on the top of the shelf for something, that requires some form of stability or mobility as well. And that's just your normal daily activity. So we would want to implement those things to help improve. We can see great range of motion. We can see good improvement on stability. Now, can we assess that? Sure, we can assess it. There's assessments that we can do that can assess your range of motion, how flexible you are. So we could do like hip flexion, knee flexion, torso flexion. We could do a lot of assessments that can assess the degree as to which you're able to flex. And we see if there's improvement there.
Wow. So, let's just dial this back. So we started this podcast with, okay, for longevity, you need a strong body, and everybody would agree. I think the best evidence that that's critically important would be think about its absence. Mm-hmm. Like, do you want to be alive, longevity, with a weak body, being frail? That nobody's signing up for that, right? But what you've described in that strong body is very complex. Like, we're talking about aerobic fitness and VO2 testing and strength and muscle mass and stability and flexibility, balance, and all of these things. How does somebody put this all together? Like, how do they? And then not to dismiss hormones and the medical
right.
issues and all those things. Where do people go to figure this out?
Well, you come to us first, and then we'll help you.
Did you see the lead into that? Like, but it is complex. Like, I think that, that's for you and I. We've spent a career learning these things, right? We have expertise that is different, but the combination of this, like, as a cardiologist, I don't know everything about exercise physiology. Of course, I know this much. I just know it's critically important. But if I can identify an expert like you, then I don't have to spend 10 years studying exercise physiology to figure out where the best opportunities are, where are the mistakes are going to be, all those things. I come to you and you simplify all that. You take your decades of experience at this and you allow me to go faster and put it together quicker.
Yeah, I always thought that as I was a undergrad college student that we should complement each other. Like, we shouldn't work against each other. I feel like sometimes being in the industry where I'm trying to prolong life and try to help someone, I didn't want to just sustain it. I wanted to see people grow and get better and do more. But when I had a stint in the hospital working in the RD department, I saw a lot of just sustaining life, like just getting people to the next day with their medicine, and those individuals going through surgeries from, amputations from diabetes complications. So it was a very negative experience for me. And I felt like we could do so much better together if we looked at ways to help people get better. And we promoted that longevity of life and wanting to be healthier and do more for yourself. So that you don't have to know every single thing, because you don't have time, right? Yeah. I don't have time to be a doctor as well. I spent my time in exercise physiology. So it would be important for us to band together to create this unified health opportunity. And I think what we're doing here kind of simulates what I thought was necessary for people to be able to have healthcare and individuals who are looking to help them improve their overall physical health.
Yeah, that's, the last step in the longevity framework that we talk about is the how. A lot of times people can figure out what they need to do. Sometimes they need some clarification of that. But what they might miss in that is the how. And I'll hear patients sometimes say, "Well, I don't need a health coach because I already know what to do." Although from an external view, you say, "Well, how's that working out for you?" But that's where the expertise comes in. Is that you finding that team to help you learn faster, to grow faster. And I love what you said there, is that growth part. Like, there's a business axiom that if you're comfortable, you're not growing. And if you're not growing, you're dying. And I think that applies to medicine, to life as well. Well, Chestiny, thank you so much for being a guest on the HealthspanMD podcast. It's really been a joy to have you here. And I'm really excited about you joining our team as well.
Thanks for having me.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience healthcare as it should be.